Hashimoto thyroiditis is an autoimmune disease caused by self-intolerance to thyroid antigens, leading to destruction of thyroid gland. It is the most common cause of hypothyroidism in regions with adequate iodine levels, and likely to occur in female than male. It is characterized by the presence of circulating autoantibodies against thyroglobulin and thyroid peroxidase. Normally, thyroid gland function to produce and secrete thyroid hormone to regulate metabolic rate and necessary for cell growth. The thyroid follicular cells require iodide from the blood and store it within the colloid to produce thyroid hormone. Once inside the colloid, iodide was oxidized by hydrogen peroxide facilitated by peroxidase enzyme. Oxidized iodide bound with specific amino acid tyrosine on a protein called thyroglobulin. The bound on 1-iodine to tyrosine produces monoiodotyrosine, MIT, and 2-iodine to tyrosine produces diiodotyrosine, DIT. Within the colloid, both MIT and DIT undergo structural modification by various enzymes, in order to couple them together. When two DIT molecules that are appropriately modified, they are ready to be coupled, giving a molecule of thyroxine, T4. And the combination of one MIT with one DIT forming triiodothyronine, T3. Pathogenesis of Hashimoto thyroiditis was involved in a strong genetic component. It was believed to be associated with gene like CTLA4 gene, PTPN22 gene, and gene that coded for MHCDR5 that involved in regulation of T-cell response to endogenous antigens. This may cause abnormalities of regulatory T-cell or self-immunologic response to normal sequestered thyroid antigens, that producing autoantibodies against thyroid antigens. Progressive destruction of thyroid epithelial cells would result replacement of thyroid tissue by mononuclear cell infiltration, and the formation of lymphoid follicles with well-developed germinal centers. Fibrosis, caused by increased interstitial connective tissue and atrophy of thyroid follicles. In addition, as cellular adaptation of thyrocyte by chronic inflammation. Some of thyroid epithelial cell would undergo metaplasia that appeared as eosinophilic granular cytoplasm which called Hürthle cell. Because of that, Hashimoto patients have a greater risk with papillary carcinomas, non-Hodgkin lymphomas, and other autoimmune diseases. Mechanism of thyroid destruction could be followed by 3 ways, include 1. Hypersensitivity type 4, T-cell mediated. CD8 plus T cells are the main mediators that responsible for thyroid epithelial destruction. 2. Cytokine mediated, activation of T helper cell produces inflammatory cytokines such as interferon gamma, to recruit and activate macrophage to injure the thyroid follicular cell. 3. Hypersensitivity type 2, antibody dependent. Plasma cells start to produce thyroid antibodies such as antithyroglobulin antibodies and antithyroid peroxidase antibodies, which has affinity to thyroid follicle. This would trigger thyroid epithelial cell destruction by antibody-dependent cell-mediated cytotoxicity of NK cells activity. Sign and symptoms of Hashimoto's thyroiditis include fatigue, muscle weakness, slowing mental activity, weight gain, cold intolerance, decreased sweating, bradycardia, decreased cardiac output, shortness of breath, oligomenorrhea, hypercholesterolemia, constipation, diffuse and symmetric enlargement of thyroid gland and also associated with myxedema. However, there are transient thyrotoxicosis at early stages, due to destruction of thyroid follicles with secondary release of thyroid hormones. Diagnosis usually done by laboratory findings that shown low T4 and high TSH level, positive antithyroglobulin and antithyroid peroxidase antibodies. Microscopical finding, done by fine needle aspiration cytology, that would provide appearance of tissue inflammation. Epithelial changes and sometime may present along with fibrosis and positive Hürthle cell that refer to metaplasia of thyroid epithelial cell. Nowadays, there are no cure for Hashimoto's thyroiditis, and the patient could even fatal by the complication of hypothyroidism without treatment. Long-term thyroid hormone replacement therapy, like levothyroxine, will be provided to prolong the life and quality of patient life. In summary, Hashimoto thyroiditis is an autoimmune disease caused by self-intolerance to thyroid antigens, leading to self-destruction of thyroid gland, that leaving it with chronic inflammation, epithelial changes, and fibrosis. Pathogenesis of Hashimoto thyroiditis was involved in a strong genetic component that altered immunologic response against self-antigen to thyroid tissue. Symptoms of Hashimoto disease include fatigue, muscle weakness, slowing mental activity, weight gain, cold intolerance, decreased sweating, bradycardia, decreased cardiac output, shortness of breath, oligomenorrhea, hypercholesterolemia, constipation, symmetric diffuse enlargement of thyroid gland, and also associate with myxedema. Diagnosis depending in laboratory finding that shown elevate TSH and decrease amount of thyroxine. Positive autoantibodies against thyroglobulin and thyroid peroxidase. Microscopic shown inflammation of thyroid tissue, epithelial changes with sometimes thyroid follicular fibrosis. Currently, there are no treatment for Hashimoto thyroiditis, but thyroid hormone replacement therapy like levothyroxine could help to prolong and improve quality of life. That's it for the topic. If you find this video useful, please give us a like and don't forget to subscribe. Thank you for watching.